I'm a big believer in evidence-based treatment. In other words, I'm a believer in having treatments that have been found in scientific investigations to actually be effective. There are an enormous number of treatments out there that don't have any evidence, and there are an enormous number of problems that we don't have treatments for. The behavior therapist's point of view is that treatments need to be validated. You need to have data that they in fact work, okay? And the American Psychological Association would say that a treatment has to be replicated at least 3 times before you can call it an evidence-based treatment. It's very easy to get one study that shows something works, but then never get it replicated. In other words, other people try to show that it works again, but it doesn't work in the next study. And we have loads of therapies like that. Okay. The problem with psychological interventions is that historically, they have been viewed as more art than science. Medicine at one point was also viewed as more art than science. And medicine went from art to science. And now there's all sorts of federal controls on what you can do, and that medications cannot be sold if they haven't been determined already to be evidence-based and not harmful. The problem in psychological interventions is that although we now have a lot of treatments that are evidence-based, there's no requirement that I know of, hardly anywhere except a couple of states, that people be provided evidence-based. In other words, the FDA doesn't let drugs go out that aren't evidence-based, but there's no one saying this psychotherapy can't go out because there's no evidence for it. And that being said, evidence-based treatments are often not being taught in graduate schools. Evidence-based psychological treatments are ordinarily not taught in psychiatry programs. There's a requirement in medical school that you can't teach residents and medical students to use medications and procedures that have no evidence. Here's the problem. Many people grew up and got trained before there was a lot of evidence-based treatments. The behavioral treatments were criticized for years as only treating what was called symptoms. I don't think anybody would say that now. The data is too overwhelming for anyone to say it now. But the facts of the matter are, you have thousands of people trained in non-evidence-based treatments. So it's in their interest to keep up the battle that research is not that important, because they could lose their jobs or not be able to practice. So there's a huge incentive, but this is not unique to psychological interventions. It happened in medicine too. So it's just a battle that we haven't won yet, to where insurance companies require evidence-based treatments. The government requires it, states require it. We have some states that are requiring people to provide evidence-based treatments, some places where they'll pay you more if you do it. We just haven't won this battle yet.